Welcome back to News Check. Thank you so much for keeping me company. And of course, with our guests here, we are looking at the socio-economic impact of COVID-19. And especially now that things are slowly but surely starting to look up, what are some of the things we have been able to endure? Something that has affected you and perhaps you never notice it affected each and every one of us. Also psychologically, of course, economically, and of course, as a country, we are trying to pick up the pieces, and so should you in your life. And Daktari here and Newton, we are trying to put those things into perspective. Perhaps you wanted to add something on the social protection before you tell us how can we ease the mental pressure, because at the end of the day, even if you have all the money in the world, and of course everything is going on as planned, business is okay, because there are some people who have not been affected economically, but at the end of the day they have been affected mentally and psychologically. Daktari.
Very important issue to consider. In terms of healthcare, my view of this is the government has some good ideas about universal health coverage. When this is implemented, then we will be able to provide healthcare to as huge percentage of the population as possible. As it is now, the number of Kenyans that have access to some sort of an insurance coverage, those working in the private sector, it's 1 million and a few hundred thousands of Kenyans. So less than 2 million Kenyans have access to private medical insurance.
Yes.
The number of people that are covered by NHIF, because their payments are remitted by their employers, working in the public service, in the civil service, in the police force, is equally not a huge number. So the number of Kenyans that have to meet their medical expenses out of pocket, you know, they have to pay for health care directly with their meager earnings, is more than 70% of Kenyans.
Yes.
Which is an extremely unfortunate situation. So I feel that that is one of the vulnerable groups of people that needs to be addressed in terms of healthcare. How? By availing healthcare to each and everyone in the country, if possible. How? The universal health coverage, a very good idea. Implementation, we pray that happens, and happens quick. Should have happened yesterday. So very important. Then the allocation from the budget, per capita allocation for every Kenyan. When we check the budget, how much has been allocated for healthcare?
Yes.
How much has been allocated specifically for mental health care? You know, for each and every Kenyan. Very important that the government actually ups the game. We have had declaration in the past that a given percentage, more than 15% of the annual budgetary allocation should go to healthcare. Where are we in Kenya? Less than 10% of the annual budgetary allocation goes to healthcare. Goes against the Abuja declaration and all that, which actually recommends a certain per capita and GDP allocation to healthcare. So this will go a long way in ensuring that there is protection of the vulnerable population in terms of healthcare. Yes.
How do we ease mental pressure as things are right now? Exercises and trying to be positive, of course, counselors will tell you all that, and even doc will tell us all that. How do we ease mental pressure?
How do we ease mental pressure? Very important point. Affects each and every person, because we are going through difficult situation, difficult circumstances, you know, and it's very important. One, how do you eat? The food you eat affects the mood.
Yeah.
Food and mood are closely related. Are we eating well? Or we are eating junk, you know, taking a lot of alcohol, smoking, you know, using psychoactive substances and all that. So it begins from diet. Nutritionists will advise us that what you eat has a lot of impact on your health status. Garbage in, garbage out.
Yes.
It's not just garbage out because you go to the washroom. It's also garbage out in terms of, you know, how do you think, how do you perceive the world. The brain needs energy, you know, and the brain needs good food. The brain needs good nourishment. So let us eat well. And then too, let us exercise, like you hinted. Engage in physical activity, you know. Many people working in white-collar jobs, sedentary lifestyle on the desk throughout the day, engage in some active activity. The recommendation is, at least exercise 180 minutes every week. If you have to divide 180 minutes every week, every single day, then engage in vigorous activity that tires the body at least 1 hour every day. It could be jogging, could be playing soccer, it could be, some people are working in manual jobs, maybe for them that is addressed that way, but get some physical exercise to engage in. And then, of course, avoid stressful circumstances. Try as much as possible to minimize the levels of stressful things. That is by practicing useful techniques like mindfulness, being aware of where we are, our environment, the things that are going on, taking note of what is the situation that I'm going through and how are we addressing these issues. So mindfulness, how do we sort out the issues surrounding us? And then, of course, there is awareness of bad things happening. When bad things happen, we need a way to ventilate. So right now, we have been going through the COVID-19 pandemic. Where do our people go to ventilate? We are doing that here. We have our churches, we have the chamas for women, we have us, I'm sorry, Man United, Riverbrook.
Yes, games and
0-5, of course, is -5.
Yes.
Sorry, Man United fans.
Yes.
But of course, when you're going for these games, man, don't indulge too much in alcohol, you see. Because this is bad. It's unfortunate that, like in our setup for us men, these things tend to go hand in hand, as we are spectating this soccer.
So we could end up trying to ventilate, but at the end of the day, we are also putting in some other problems.
Taking one too many. So we need to think about all these circumstances, so that we are able to ease the sort of mental fatigue, sort of mental stress that we've been going through.
I'm quite sure, Newton, you can tell us what you've been doing, and especially in the orphanage homes and some of the houses. You built quite a number of houses for widows in your county. And of course, how has the situation been right now for the elderly and people with disabilities, and especially now that the COVID pandemic has really hit and things are starting to ease up? Have you perhaps even gotten any help, or some people chipping in to help those vulnerable, very, very vulnerable, the elderly and people with disabilities?
I have not stopped doing it. I trust in God, and He has been giving me some people who actually still support. Even I'm going back today, tomorrow I'm sure of building another one house. Next week I'm sure of building another 2 or 3 houses. Even though we have been reaching a lot of challenges, as we said before, but we still have some good people who can say, okay, it is difficult, but let me share whatever little I have with other people who don't have down there. There's something that I wanted to emphasize on, or to push, both politically and development in the community. What I'm doing is development in the community. We are going back to the people and to give back to the community. The money that now we are using in Kenya for campaign is more than enough to build the houses and support the widows and the orphans in the entire country. But we are using it to win the seats. While some people outside the country who are not even interested in any political office are busy sending us money to build and to support our own children, our own women, our own mothers in this country. I'm sure it's not even bad if I say shame on us. Because tomorrow we will wake up and go do voting for our good leaders, from the MCA to the presidency. But after election, after the date of election, nobody will think that there is another widow, elderly, and a grandchild to the orphan who is living outside without a shelter. It is not easy, and I will stand in, my brother. I will stand and I will speak the truth day by day to the widows of this Republic of Kenya, to the orphans of this Republic of Kenya, because we are always forgetting about them. I'm requesting our members, our fellow member of this country, that even though it is difficult, can we share? Can we share? We had pandemic, we had issues, they are still alive. I was having a case in Guasi, Homa Bay County, where that lady is around 70 years old, living in something that we cannot call a house. If you're inside the house, you see the sky. If you're inside the house, you see whoever is walking outside, and the house is by the lake. And this grandparent is having 2 grandchildren who are orphan in the same problem. If you're talking about the mental issues, what do you think these children are undergoing in such kind of a situation? What do you think this elderly mother who is a widow is undergoing with her own grandchildren, surviving with her without food, without no house, without no bedding? I want to say that I thank those who have been supporting my organization from the United States. I thank them, and may God bless their pockets.
No one is helping you from right here in the country, Kenya?
Maybe 2 or 3. I can only mention there's a guy, my friend called Maurice. He's running a big organization like what I'm doing. It's called Mana. Mana Ministry has been feeding number of less
It's a ministry, not either business people or politicians.
No, the politicians always need their portion. They help you to give them vote, and you will never see them. I've never ever called even them into my organization, because I know what they want. Their faith there is not to help, but their faith there is to challenge my mind so that we can get the vote. But the ministry, the man I'm talking about, has been doing a lot in this country. This guy, whenever I call, when I'm in need, he always supports me. There's a ministry called Gideon's. Gideon's is located in Kabondo. The brother there is called Newton Onyango, as my name. Is doing a big and a wonderful project there. He's having over 100 orphans. He's having a number of widows. He's feeding the community. We work with him together. This guy is really supporting, even if you don't support my organization, but support the same people that we are supporting. We have some other small organizations which are coming up with the same motive of work. But the senior people in this country, unless if they want to support, they go to gathering, then they give 1 million, 2 million, 3 million to be shown in the TV or to be announced. But I want to thank those who have been supporting us, because even though we had a pandemic, we have been still reaching. 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 Even now I'm building a dormitory for the orphans and the kids I have at the orphanage. And I still have some people who support me to build it. You know, so they have not stopped because of pandemic, but only the challenge I have, the limit is not now the same as before, but we are still working out. Yeah.
Indeed, and of course, Newton is a good job that you're doing. We've seen some of your work, and of course, when the COVID-19 pandemic, I do remember hit us. You said you're not going to stop on that, and of course, the campaign, guys, to tie what she's been talking about and what she's officiating is that the young and the vulnerable continue to face all the challenges that can come at a worst time. Like now we are having COVID-19, and a lot could be done by even county governments, as Newton, you had put it, but a little seems to be done. Talking about a girl who was found in the forests, having been defiled and left for dead.
This is the situation we are in Kenya, and I only talk about the one who was found in the forest, which I know it was in Homa Bay County. We have many others who have not been found. We have many others who are struggling. We have many others who there's nobody to stand.
And there are others who haven't
speak.
Even reported, because the numbers of those who report cases of perhaps of rape, of defilement, of mistreatment are very few.
We have the girl child ministry, I don't know how to put it, in this country. And we have women, like all the women rep, I think they should stand for the women, for the girls' right and the girl child. But I don't see anything happening, because number one, you remember the president announced that the chiefs will be responsible for the girls who are pregnant during the COVID.
Yes.
Because I don't know how the chiefs were getting involved, but because they are leaders of the community. But this is not about the chiefs or about the president. This is about the women leaders, because they know the language they should speak with the girls. Even now, that is the incident which occurred in Homa Bay County. The girl who was found in the forest. I've never had any women representative talking about it. I've never heard anybody standing in, coming here to the TV or going to the hospital to check how she's managing herself. Nobody knows what she's eating there. Nobody knows where she's getting the medication. We only heard about the news, and we can see people going to the stage and talking. But there's a very big need in the circumstances of the girl child, girl's right, the boy child. They are there. And we need to speak about these things and find the solution. I've talked about the counselors. I think we need to have or to add counselors in various communities. We need to have them in schools. We need to have them in churches so that we can reduce the early pregnancy. I was talking about the widows, the orphans, and the single mothers. What is it bringing a big number to have a single mothers in the country? Because somehow we don't have socio people who can actually wake up and think of talking, have a talk, have a health talk, have a social talk with our boy child and our girl child. But now it's actually the truth that we already failed, because we cannot even put the percentage of how many underage girls who are pregnant today and having children. We cannot talk about it. And this thing affecting the old mama, the Wanjiku, in the community, because you are there with your girl who is around 15 years old, and she's coming back with another child who is 1 day old, and maybe your grandchild is an orphan. You know, so the poverty continue coming up because we have not taken it serious. Like up to date, the girl I'm talking about who is in Rachuonyo Hospital, she's unknown. We don't know where she's coming from. We don't know even after if she gets better. We don't know where we are taking her. Because there's no any family who was to actually come and witness that is their child. Those who have been coming, that is, they don't know. And when they come, they don't know, they just go. So there's a gap in between the poor and the rich. There's a gap between the leaders and the people that they lead. There's a really big gap that I don't even know. Like my brother talked about, it's called Kivuta Kibwana.
Yeah.
If the person that I'm seeing is suitable to lead the country is him, because already he has proven to us that the little money he's getting to his county is more than enough, because you have done what we have never seen in this country since we have devolution. If I go back to my country there, I think I have nothing to count on from the county government, even a single thing. I don't know what to count there. Even if I go to the neighboring counties, they have not done much. Like, let me talk about my county because that's where I belong. Our referral hospital in Homa Bay, there's nothing there. We refer our patient to Kisii or to Kisumu. Is it that the county government of Homa Bay is not getting what the county of Kisumu is getting? That's a question. And it's not about only Homa Bay County. We have other counties around here, which you don't even know if they are getting the same. But my advice to our people, and as per my opinion, because me, I'm not joining politics, but my advice to
that was
people,
my next question, whether you have any political ambitions that perhaps you can try and change things.
If the way they lead is the way that I'm going to lead, then I better stay in my organization. Okay. I'm doing much better when I'm outside than when I'm inside. So because even if I join the politics tomorrow, I'm going to get the same people. Some days, my friend, this guy, he said about nyani ni nyani, the monkey is the monkey. The problem is that they can change the forest. Yes. But they're still the same, you know? So even if I join politics today, I will not do much. Because number one, the corruption is already there and nobody is being jailed. And I don't want to be counted under the same. So what I'm trying to urge those who are interested in politics, that even though you are going to earn your salary, can you think about those who voted to you? Now I told you before, now everybody is telling us about registration of the voters. You will see the mental cases that I was talking about here being and those who cannot walk. You will see them. We take them to the centers to get the votes, to vote who and to vote for what. This time we are telling our candidates, we want to vote for change. We want to vote for the person who will actually come back to the community and understand the fate of a widow, of an orphan, or of a single mother, and the fate of our children. For example, why do we have many orphans and many widows in the community? Number one is health. Number two is AIDS. AIDS is actually in the line of the health. Our women sometimes are getting involved in such cases because they have nothing to eat at home. Our girls who are getting pregnant, they are being impregnated with youths or the motorbike riders or those who are just hanging around because sometimes they have been given 20 shillings to buy their pads.
It's true.
What is happening with the leaders or the women in the power? The Constitution of Kenya talked about we bring about electing the women reps. Why did we elect them? They have enough money. But if I ask them today, what have they done to change the life of the girls who will be tomorrow the women leaders in the community? The best they do is to make sure that they push them down to the ground so that they remain in power. But here, the truth is, Kenya belongs to all of us. The children belongs to all of that. So my request to our country, or our leaders, can we swallow our pride and ambition of to get into power and to go back and look where we came from?
Indeed.
That is my mission.
And Doc, perhaps you can chip in with perhaps what has just transpired about the vulnerable communities. And I do remember health practitioners have for a while now asked for a health commission which will take care of, among other, some of the issues that we have been grappling with for the last couple of years. Do you still believe it is going to help? It came up with the BBI. I don't know how it can be actualized, but at the end of the day, do you still believe that a health commission will try to address some of the issues? Because at the end of the day, as Newton has put it, and I know as a parent, is that very well, kids always are sick when you don't have money. And if you don't have a cover, it brings a lot of problems. Yes? Daktari.
Okay. We have to admit that a lot of policy issues, a lot of rules and regulation, and how the government works in Kenya has changed a lot with this devolution situation. In the past, all healthcare was centralized in the Ministry of Health. Decisions were made centrally about hiring healthcare workers, about deployment of healthcare workers, about allocation of resources, about construction of new hospitals and all that. Devolution has its promise, and in some places devolution has worked. Called a spade a spade. In Kifuda Kibwana's county, it has worked. If you go to Kakamega, the governor for Kakamega, that should be Oparanya. You know, you can clearly see some things that are happening here with charity. Giru, you know, you can see, well, in Machakos we saw ambulances, but it's unfortunate, you know, ambulances are for carrying sick people. Why are you not treating them? Why do you have to carry them elsewhere? Treat them where you are. So you see, well, was it showbiz? We no longer see those branded red and blue ambulances. So it's about politics, but at the end of the day, politics is about the people. And politics goes a wrong way. It has been discussed for centuries. You know, from the Greek philosophers, Plato, Aristotle, they were always asking, how do we get the best kind of leaders? Maybe it is when philosophers are leaders. Well, even the Jews, they were waiting for their leader, Jesus Christ. They expected a leader who will
have big offices, you know, and everything. Yes.
Even the Muslims with Muhammad.
Yes.
You know, it's about leadership. But then, where the tire hits the road is that today and now, in our hospitals, we need medicine, we need doctors, and we need all that. Is it working with devolution? Yes and no. We have a lot of teething problems, and one of the recommendations that has been put forward is that we need to decentralize healthcare, which is where a health service commission would come in. We have commissions for different things in Kenya.
Yes.
You know, the task force has for mental health actually recommended that we need a commission for happiness, you see, to measure the happiness levels of Kenyans. How happy are you? How happy am I?
Yes.
We need a commission for that. We have the Teacher Service Commission. But despite that, we have been having all those strikes by the teachers going back many years. You know, we have other commissions for X, Y, Z, A, B, C, D, all the letters of the alphabet. So are they working? Each commission has its mandate stipulated in its in its formation and by the Constitution, the Judicial Service Commission, Police Service Commission, and all that. Do I feel that healthcare needs that? Yes. Why? Because this is a unique service in the country. And despite being unique, we have a limitation in the number of healthcare workers that need to be deployed. So whatever we have needs to be shared. You know, between Machakos and Mombasa County, between Kisumu and Wajir County, between Turkana County and the other county. But now when everybody is running their own show, inequalities happen, which is why Homa Bay will refer its patients to Kisii or to Kisumu. There is no measure of bringing in some level of equity and a rational distribution of healthcare workers. So this needs to be addressed. There is a promise for the formation of a health advisory commission, you know, having a director up there to rationalize all these redistribution. But the feeling is that a health service commission will perform this purpose quite well. But besides the point, we don't need to lose also the gains that came with devolution. How? That, you know, these resources are trickling down to the grassroots. So it needs a lot of prudence, a lot of self-giving, a lot of morality and ethics. You know, I wish we could have a way or a school that can teach political ethics and political morality, because it pains me, it pains you, and it pains anyone when you go to a county somewhere, and I can give specific examples of counties where I know I, as a doctor, when I go to that hospital, if I prescribe medicine, patients will not get medicine. Why? Because money that was meant to procure medicine was redirected to something by the politician and the cronies and the Cross family, you know, to their own pockets. And we can pinpoint, you know, this house was built here, this shamba was built here, and most likely it is proceeds of corruption, of money that should have been directed to the public good. You see, it's quite unfortunate, and it pains Kenyans. And I feel it's about ethics, morality, and the kind of leadership that we have. We have a crisis of leadership, and I don't know how we are going to enlighten our society and our leaders to change about these things, because it is shameful, honestly. It is extremely shameful to know that a governor is misappropriating resources, and because of the misappropriation of resources, people are dying. No.
Indeed. And Newton, you raised that issue a while back and said that, of course, you will find that these people will not seek treatment here. They're going to seek treatment elsewhere because they have at least the funds or the cover that they have. But the vulnerable, and especially now that we have COVID, they will not get that chance that will be told by Daktari, I recommend this medicine or I prescribe these medicines, but you cannot get them here. And that is a serious problem when it comes to health matters in counties.
You know, number one, we have health workers, we have government workers entirely. You will find they're being deducted the remittance to NHIF. And when they go to the hospital, they will come back without treated because their remittance were not channeled to the NHIF. So you're being already deducted and it is not there. That is number one. So it's not about even the vulnerable alone. It's about the management in this country. Sometimes I cry and I say, better we go back to the national government, because the county government has failed, because the money has been channeled to the county, and 2 or 3 people are using this money in a wrong way. But my problem is one. I've never seen any in court being jailed for 10 years in using public funds in a wrong way. I've never seen one. If you have seen one, tell me. There is no one in jail today, but we have number of thousands of people who are being jailed because they steal chicken. or they have still something simple. So I don't know how the government or the president been taking this to. Because, for example, now if I talk about the county government issues, it is not worth to be discussed because there is nothing in the ground. If I'm not talking about the person who now cannot afford the health care, but this is the person who worked for it, is being deducted, but the money is not there in the NHIF system. When the COVID came, they said the NHIF is not covering the COVID patient. The COVID patient has been paying the insurance. I want to talk about those who can support themselves.
Yes.
Then where am I going to get? I'm being paid 20,000 a month. They already deduct my money for my health, and then the COVID now is not a disease. It's something that cannot be treated with the same health cover. These people, one time I said, they can go to outside the country and get treated and come back with billions of money, which is our tax. And they refused to go back and support our own children, our own orphans, our own widows. I said here before that I will stand in for the widows. I'm now start looking how I can actually register a number of them into NHIF and look for money to pay for them. Because number one, we have some deaths which are actually occur because of simple things that we can, like the way the doctor said, you prescribe the medicine and the medicine is not in the hospital. I have a patient now at the hospital, the lady that I'm talking about. I'm buying medicine from outside or I source from my hospital to go and be treated, my patient at the hospital. I'm even buying a gloves, just a gloves. Do you think they can be referral taken to that kind of an hospital? No. The referral are now being taken to private hospitals, or we go to other counties. When my people goes to other county referral hospitals, they're being frustrated because the other counties are asking, our hospital is full. And we have been given the similar amount of money that you have been given. What happened to yours? Then most of the patients are now dying because of such kind of, I do call them stupidity. You know, you're going to eat from the neighbor and you have the similar food in your house and you cannot cook it. So I'm just urging the national government, please, the incoming president or the current president, whoever is going to seek for any power, please can we sit down as Kenyans and we strategize on how we can change this management of our resources. Number two, we need somebody who is in charge for the widows and the orphans in this country. We need to know it's who that we can approach and talk with. We need to know who is standing in for the girl child, the girl right. We need to know them. If they cannot afford, then let them uplift the private sector to be given the chance and the power to handle and to manage this kind of problems in the country. And that person must be given their location so that we can reach out in the grassroots. Last time I said, reaching people in the TV is not enough. Announcing what the government is taking to the country is not enough. Can we have people going to the grassroots, working with the assistant chief, working with the village elders, so that we can reach a person who cannot even afford to buy a battery to listen to what is being announced at the radio or at the TV. So I think, my brother, what we want, Njue, is to make sure that we localize a lot of things and have a talk. Even with the, I've been urging to meet the president. I don't know how I can meet him, so that we can talk one-on-one with him and we can address these issues, because I know there's no president good as Uhuru Kenyatta. I'm telling you the truth. I've never met him, I've never greeted him, but I feel that he has the people's heart. His heart is big to carry everybody. But the people surrounding him are blocking him to reach the people that he need to meet and talk to.
Of course. Yeah. Dr. perhaps you can add on that, and because of the interest of time, there is a question. Of course, it's not quite related to what we are talking about, but we have seen situations where, and working at the courts, where before you're charged with murder, you go for a psychiatric evaluation. Can you briefly tell us exactly what happens in that psychiatric evaluation, if you don't mind?
Okay. That's quite a technical question. This is what happens. We have a field called forensic psychology. This is where law and psychology, if we call it that, and psychiatry tend to merge. And how do they do that? That a lot of the things that people do, it's about human behavior. You know, when someone commits a crime, it's essentially human behavior gone rogue. Okay?
Yeah.
And there are very many motivations for anyone to commit a crime. It could be premeditated, okay? Or it could be an event that happens at the spur of the moment. It was not premeditated, it just struck someone. Let me give an example. It could be a bit off, but it's a man, he's gone home, coming from work, late in the evening, found that there's another man in the house, and the wife is there, they're in the bedroom. In a fit of rage, the man picks a knife from the kitchen and stabs the intruder. You know, it's a fit of rage.
Yes.
Okay. Another situation, a man has a debt of another man. He has been asking, repay my debt for so long, but then the debtor is not paying. And this man is seething with anger and resentment, and he decides to go look for a gun and meets the debtor in the streets and shoots him. You know, he's had all the time in the world to think about it.
That was premeditated.
So it was. But then now, these are two people that have been put in the remand
They have
cells.
come to Madare and you are the doc, yeah?
No,
You have
they
been
will
told
first
to-
be arrested by the police. You know,
Of course, they will be taken to court.
they will be
ask
taken to
for a
the
miscellaneous
cells, and
application.
then they will be taken to court, arraigned before a judge. And the police, the prosecuting officer will taper down the evidence. He did this, he did this. And then the judge has to weigh the evidence that is presented. But then now, how does the court decide? Why did this event happen? So that is where the issue of mental status examination or forensic evaluation comes in. And it can only be done by someone who is skilled in that. The doctor or the psychiatrist will go and evaluate this person and find out what was the milieu, what was the environment around that event happening. Or even if it is not around that event, what is the general mental status of this person? Which answers your question, what is mental status examination? Essentially, you know, it is one thing that I think we need to wake up to, that we play soccer with our feet, you know. We run, our athletes go and run on their feet. But at the end of the day, our brains, our minds are very complex and interesting organs. And every single thing that you do, it boils down to the brain. How you think, how you feel, how we make decisions, how we make choices, how we make judgments, it's about the brain. And the brain needs to be in a good status for thinking, for perceiving the world. And that is exactly what happens when the patient goes for mental status examination. As a doctor, I want to find, how is this person perceiving the world? How is the cognitive status of this person? How is the judgment and the decision making? How are their feelings, thoughts, and emotions? And what is the influence on their behavior? Can it be said this person committed the crime because, well, they were not in the right state of mind?
Of course. That's another discussion for another day. Your final comments, Newton?
My final comment is we need to change the country in any way we can. Number two, I'm urging for the officials, the government officials, to do good in their areas of work. Number three, I am asking for the president or the presidency or the management there to take care of all the country and make sure, this is my request to them, to meet with the private sectors, NGOs who are working down there, so that we can bring our agenda to them. So when they are campaigning, they are doing all the things that they do, they listen to the other part of the private sector, the challenges that we are getting and what we are going through.
Okay. Daktari, final words, 30 seconds.
Thank you very much, Misheni, for inviting us here. I'm happy that our society is awake to this conversation that we are having about what is the socio-economic impact of COVID-19 on our society, on ourselves, on our children, on our vulnerable people. And then we need to continue this conversation going.
Yes.
Everyone out there, be thoughtful, be aware about the mental health wellness of yourself, your neighbor, your family, and everyone in the society. And let us fight shame and stigma, and let us enhance the mental health of everyone.
Thank you so much, Dr. Leonard Njiru. Incidentally or coincidentally, we were in the same class 21 years ago.
21 years ago.
Yes, of course, he became a doctor. I became a journalist. And Newton Ogada, Philanthropist, thank you so much for what you do and for creating time, gentlemen, for the show. Indeed, you have been watching News Check, and we have been looking at socio-economic impact of COVID-19. And of course, it has affected each and every sector. But now we slowly but surely picking up the pieces so that we may be able to go back to our normal now. We had a new normal. We want our old normal and better than what we had before COVID-19. Thank you so much for watching. I'm now giving rise to my colleague Gladys Mungai, who will be coming up with Tamrini after she gives us what is the latest in the news in Kurunzi Mashinani. Thank you so much for watching. I'm Njue, and Anwangeshi has been our sign language interpreter for this show. Have a good one.